Let's do this.
Hi, just joining. Sorry for being a bit late. But
that's okay.
already.
We are live right now. Thank you. Hello, 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 and welcome to the final day of the Organization of Eastern Caribbean States Human Data for Development Conference. We are happy to bring you this forum in partnership with UNICEF and USAID. I am your host, Alicia Ali. Bienvenida, bienvenue, welcome to all of you. Let us know who you're representing in the chat. Drop your flag. Let us know the organization you're representing. We want to know so that we can connect with you. It has certainly been a powerful 3 days. We have learned that data are available, and we must make an effort to strengthen the use of data for inclusive and sustainable human development. We've gotten an insight into the data gaps in the OACS region. Over the last 2 days, we have covered topics on the importance of the quality of data we have, advances in data systems in the OECS, how GIS mapping and data visualization are impacting positively our sectors in the region, and how data is being used to transform our systems and institutions. We spoke here about social transformation in our societies in the OECS for the benefit of the lives and livelihoods of the people of our region. Don't worry if you weren't able to or aren't able to attend all the sessions. The videos are available on demand. Remember to check our exhibit hall when you have some time. Fill your swag bag, meet our booth representatives, leave your business cards, connect to us. We are happy to meet you. We are happy to connect with you. Without further ado, let's jump into today's agenda. Our first session is on population data tracking progress in human development. Let me hand you over to our very capable moderator, Shuma Biru, who is a technical specialist in the Statistical Services Unit at the OECS Commission. Shuma, over to you.
Hi, good morning, and thank you, Alicia, for that very vibrant welcome. As Alicia said, my name is Shuma Biru. I'm the technical specialist in the area of statistics at the OECS Commission, and I will be your moderator for the session on using information from different population surveys to track human development. In this session, the presentations will focus on the multi-indicator cluster surveys as the mix, measuring SDG 5.41, the Grenada experience, and then we wrap up with the OECS Development Indicator Dashboard. With me is a very, very able panel in the persons of Attila Hancioglu, who is the Chief of the Data Collections Unit, Data Analytics Section at the UNICEF headquarters in New York. As the Global Coordinator since 2004 of the UNICEF-supported Multi-Indicator Cluster Surveys Program, he has coordinated and provided technical support to the implementation of more than 200 mixed surveys around the world, and organized or facilitated more than 60 regional mixed workshops. His areas of expertise include survey methodology, data quality assessment, data disaggregation, and analysis of child mortality. Also with us this morning is Tatjana Karaulac. She is a statistics and monitoring specialist at the Data Collection Unit, Data and Analytics Section at the UNICEF headquarters in New York, same as Attila. She is in charge of coordinating the Mix Plus initiative. She joined UNICEF in 2013 and worked on the coordination of and technical support for the design, implementation, and analysis of mix in countries from Europe and the Central Asia region and the Democratic People's Republic of Korea. Prior to joining UNICEF, she worked for 6 years in the government sector on employment, monitoring and evaluation, and macroeconomic research and forecasting. Then we have Claudia Nicholson. She will be talking about measuring indicator 5.41. Claudia is a Grenadian labor economist with over 25 years of experience in social policy research, survey research, and program monitoring and evaluation in Canada, in the United States of America and the Caribbean. Since 2013, she has worked as an independent international development consultant in the Caribbean, where she has led and or participated in numerous monitoring and evaluation projects, capacity development training, and survey research. Ms. Nicholson currently leads the pilot to measure unpaid domestic care work in Grenada using the census approach. And of course, indicator 5.41 measures the proportion of time spent on unpaid domestic and care work by sex, age, and location. And Claudia is going to take us through the Grenada experience. And then participants this morning, we are going to wrap up with Jean Rylander, who is head of the Organization for Economic Cooperation's Development Center's work on country diagnostics and strategy. Jean and his team provide strategic advice to developing countries, helping identify reform, bottlenecks, and designing policies that will enhance a country's economic and social capacities. OECD multidimensional reviews for countries and regions are the unit's main product and have been undertaken within 19 countries. On the basis of collaboration and partnership with Millennium Challenge Cooperation teams during the country diagnostic exercises in Côte d'Ivoire and Senegal, and joint high-level events in Washington in 2016 and 2017, Jean helped set up the first memorandum of understanding between the MCC and the OECD. Since then, Jean has acted as the focal point for the collaboration and brokered collaborations in Tunisia and Morocco. Before setting up the OECD's work on country diagnosis for developing countries, Jean was the thematic lead author of the annual African Economic Outlook. Prior to joining the OECD in 2011, Jean worked with both the World Bank and the UN in evaluation. He's a Fulbright scholar and holds degrees in economics and international relations from Syracuse University and from Dresden University in Germany, and has also studied at Georgetown University in South Korea and Lund University in Sweden. Participants, colleagues, I present to you my very, very able and qualified panel. But to start off this morning, we will start with discussing the the multi-indicator cluster surveys with Attila Hancioglu and Tatjana Karaulac. I now pass on to you two. Please remember to put in your questions in the chat as the presentations go along, and we will read them towards the end of the presentations. Thank you. Enjoy the session as we pass on to our colleagues from UNICEF.
Thank you very much, Sharma. Let me share my screen first. Please let me know if you see my screen.
I could see your screen clearly.
Thank you very much.
Except in presentation, correct, presentation mode. Thank you very much.
Great,
Excellent.
thanks. We'll be doing this presentation together with Tatjana. I will do the first part on the methodology, and then Tatjana will come in on the second part to talk about the implementation of Mix Plus. But before we go into the presentation, let me thank you all for inviting us to the session and to this conference. So we are very pleased to be here. So I will do I'm going to assume that there are some colleagues who are not very familiar with Mix. So I will say a few things about Mix. Mix is a global household survey program which started in the 1990s, mid-1990s. Up to now, we have conducted 348 surveys around the world in 118 countries. It comes in rounds. We started with the first round back in the mid-90s. And each round is about 5 years, 4 to 5 years. And the latest round, which is Mix 6, the sixth round, which is we are finishing it this year, includes the largest number of surveys ever in Mix. For many reasons, partly to do with the SDGs, the excitement around the SDGs, because on the right-hand side, you see that Mix is covering a very large number of SDG indicators. Of those household survey-based indicators of SDGs, which is about 80, Mix is able to cover about half of them, which is, I think, the leader among all household surveys and many data collection methodologies. And in the middle of the screen, you can see what we have right now, some basic features of Mix 6. The number of surveys, we cover a large number of indicators. It's not only SDGs, obviously. There's 177 core indicators, and we are averaging about 12,000 households. And all our interviews are face-to-face, and we use CAPI tablets for the interviewing in Mix. So back in 2019, with an expert group meeting and a pilot in Belize, we initiated a new tool called Mix Plus. Mix Plus is a longitudinal representative household survey tool with interviews that are conducted over the phone. And I will go into the details of what this is in the next slide. It builds on the 25 years of experience that we have had with the Mix program. And we aim to collect data on the situation of children, families, and households on a frequent basis and with near real-time reporting. The basic technical support template is the same. UNICEF is in the business of creating the methodology, providing guidance and recommendations, the standards, and the actual ownership of the tool is with the countries. They're in charge of implementing, taking all the decisions on the Mix Plus. This slide is critical in that it summarizes the basic methodology. We start with this household sample frame. It can be any household sample frame. It can be a register, like the one that we're using in Mongolia right now, a population register, which is furnished with phone numbers for each household. Or it can be a completed household survey, such as a Mix, for instance, which has collected phone numbers from all the completed households. That's the starting point. From that starting point, we select a representative subsample of households from the frame. Obviously, the household sample frame itself, be it the register or a completed Mix, is a representative sample of the country. And then the representative subsample continues to be, again, representative. And once we do that, we set up a call center and a data management system. We establish an infrastructure for data management system. We create two subsystems, one for the central office and one for the interviewers. And through these, the call center and the data management system, we are ready to start calling households. To begin with, we place calls to all the selected subsample of households, direct calls using interviewers or callers. We use CATI data entry. The data is transferred to the cloud, which is captured by the data management system. There's something of an importance here at this point. When we place the first calls to all the households, let's say we have selected 2,000 households, we place calls to them. A number of them are not going to be accessible. For a number of them, the telephone numbers are not going to be correct, etc. For those households, we use a model-based conditional substitution. And this is the only time that we do substitution. Basically, for those non-responding households, we substitute them with other households which have exactly almost identical characteristics as those who have not responded. So we substitute them and we maintain the original sample size. Then we analyze and report the data. This is fairly straightforward and simple. We export the data to SPSS that we have collected, we analyze, we tabulate, we present them through statistical snapshots and through a dashboard. Now, when the first wave of calls is completed, we go back again and we place within a month or a couple of months, we place calls to the same households again. And this continues for over a period of 1 year. We do these calls to the same households on a monthly or a bi-monthly basis. So by doing so, we create over the phone a longitudinal data set. So basically what this is that we have multiple interviews conducted with the same households at regular intervals. We do telephone interviews, but when we call households, we interview one knowledgeable adult household member. The main focus is always related to children and households. However, our content is pretty flexible, and as Tatjana will show later, we focus on a variety of issues, which in some cases may not have a direct relationship to the children, but have to do with households, of course. By doing conditional substitution and by the strategy of sample implementation, we have high response rates and we achieve desired sample sizes. It is a low cost and real-time data collection tool. And once established, it provides an agile response to data needs on emerging issues. Just to give you an example, when we were doing the pilot test in Belize, COVID came in. We were in the midst of piloting and validating Mix Plus. And we quickly, within a month, we were able to modify the questionnaires and start capturing people's knowledge and attitudes towards COVID-19. We can use this, therefore, to generate cross-sectional data or longitudinal data. For each wave, since the calls are going to be representative of the whole population, we can regard this as a cross-sectional data set. Or over time, we build the longitudinal data. We can collect specific program indicators. There might be a program running in the country. We might want to see the impact of the program. We can do Mix Plus for opinion polling, or as I gave the example of Belize and COVID, we can actually use this for crisis monitoring. And at this point, I hand over to my colleague, Tatjana.
Thank you, Attila, and thank you, colleagues, for having us with you. So as Attila mentioned, we started with implementation of Mix Plus in 2020, and the first country to implement the full nationally representative survey was Mongolia. At almost the same time, we started with implementation in Georgia. Both countries finished with the implementation of Mix Plus at the end of 2021 and the beginning of 2022 for Mongolia. Mongolia, because of great success in the country and using the data to improve different areas and sectors like education during the COVID, decided to implement Mix Plus one more year. So we are just in stage of designing this year, and we should start implementing the survey during this and next months. We are also in design phase in Samoa. Both countries will implement a survey, as Attila mentioned, for at least 12 months. Again, many countries are interested to join program. The planning phase for now is in Nigeria and Vietnam. In both countries, the mix should be the sampling frame for the sample. The important thing for Mix is that collection of phone numbers in household surveys is really important. And from last year, we are encouraging to introduce additional very short module to collect phone numbers in all future Mix surveys. So this will enable us to implement Mix surveys in many countries. One of the important things that we want to emphasize is there is a methodological work in progress that actually we are analyzing and showing that the sample implementation strategy that we are using, this is especially related to substitution procedures that we are using, that this methodology is efficient and produce representative and unbiased the data. So I hope very soon we will have an analysis publicly available. For the topics that we are, for which we are collecting data in Mix Plus, as Attila said, it's a great variety. You can see on your screen Mongolia questionnaires. Mongolia conducted 7 waves in a little bit more than 1 year time. And you will see here that many topics are asked from wave to wave, like COVID, because it was very important for the country to see self-protection measures, COVID vaccination, what is going on with household living standards. We were asking about income changes, what is going on during the lockdowns, and so on. Also, one of the important topics that was repeated was distance learning. But again, there are topics that were asked only one time, like child disciplining, like gaming for children 5 to 19 years, life satisfaction, water insecurity. So, as we said, there are topics that there is no point of asking a few times during the year because of the frequency, possibility that something will be changed. But again, there are topics, they are with very high frequency of changing, like it was distance learning during the pandemic because schools were closing, opening, and so on. So it was very important to see what is going on in time. Can we go to next one, please? I just want to show you very briefly in a minute some of the results that we, for the data that we collected in Mongolia, Mix Plus. So you can see here one of protection measures in Mongolia, which was keeping distance when people are in public places. And you can see that the questions were asked in 5 ways. Questions were same, and we collected data from the same households. In February, April, and July, the rate was relatively stable because there were lockdowns, people were afraid, but then it started dropping, which was really expected, having in mind the vaccination that it was introduced, and especially in Mongolia, a very high rate of vaccination. We also have a possibility, which is one of the advantages of Mix Plus, for disaggregation. Here you can see just 2 background characteristics. This is area of residence, urban, rural, and then one of the really important thing by wealth index. So you can see the households from the poorest and the richest quintile of wealth index. So you can see the similar patterns, but still, as it was expected, the rate was dropping much faster and in urban areas and for the households from the richest quintile. One of the additional topics that was asked in Mongolia, because country is planning to introduce measures related to global warming. So the government wanted to know if people know about global warming, if they think it's happening, and how they will be, are they think that some measures needs to be introduced or not. Here you can see that around 60% of our respondents heard about global warming, and of those 44% think it's happening. Aside to global warming, there is a problem in Mongolia related to local pollutions. So this is one of the topics that is very important for the country. And they were asking if people think, is there a pollution in their area? And then 3 different types of pollution: water pollution, soil, and air pollution. And you can see that the percentages are very high. This is, of course, topic that was asked one time, and after the measures are introduced, this topic can be, of course, repeated to see if there were any improvement in how on the level of information that people receive and understanding, for example, what is global warming. So that is everything from our side for now. We are happy to answer any questions. Thank you.
Thank you so much. Thank you, Tatjana, and thank you so much for this presentation, and Attila as well. Very informative. I know that the mix has been conducted in a number of Caribbean countries, and I know that our participants hopefully would have place some of their questions in the chat, which we are going to entertain after the presentations for this segment, but quite informative. I was part of Mix St. Lucia for a little bit, so I have some knowledge of what it entails. What I really like about the mixed approach is how strategic and deliberate the conduct of the mixed survey is. I like that from start to finish, the entire process. I admire it, really it is something that should be adopted for all surveys. But so before we take any questions and comments from the colleagues who are online, we will move into Claudia Nicholson's presentation. And she's going to talk about how we measure SDG 5.4.1, unpaid domestic and care work, but that was done using the labor force survey in Grenada, which is quite interesting. It was not a standalone survey on its own, but using indicators within the labor force survey, the Grenada experience. So good morning, Claudia. Please take us through that. Thank you.
Hi, good morning. Let me just share my screen. Oh, just give me 1 second, please. Okay, so are you seeing my screen now?
Yes, very clearly, Claudia. Thank you.
Okay, thank you. Okay, so today's presentation is about the recent pilot that we did in Grenada. It was done in collaboration with the Central Statistics Office and UN Women, and the purpose was to measure SDG indicator 5.4.1, the proportion of time spent on unpaid domestic and care work by sex, age, and location. So the approach for the collection of the data is actually based on work done earlier by Deborah Budlinder, where she recommended integrating a small set of stylized retrospective questions into the household and population census. Because household surveys are not regularly administered in the region, this was seen as a feasible and cost-effective alternative approach. But however, subsequently, the Central Statistics Office recommended that we also pilot the questions in their quarterly labor force survey. In Grenada, labor force surveys are normally administered quarterly. So we did this in the first quarter of 2021. The pilot activities themselves included a virtual 2-day training of all the enumerators. We also had a informal pre-test done, and both of these activities are very essential for capturing the right data that you want to. So as I said, we incorporated 3 stylized questions into the labor force survey. It's not a separate module per se, it's just three questions. And the first question we asked was about unpaid domestic work. And that was, we asked about work that was performed the day before the interview, so yesterday. And the question reads as follows. Yesterday, how much time did you spend on housework for which you were not paid? And then we give an explanation. Housework includes activities such as cleaning the house, doing laundry, ironing, preparing and serving food, washing the car, cleaning the yard, cutting the grass, tending to your flower garden, shopping for groceries, cooking gas or other household items, paying bills and minor home repairs. Traveling or waiting time should be included in your answer. And all of this is based on the guidance that's provided in the metadata for capturing SDG indicator 5.4.1. We also, in addition to this, here in the question itself, we included activities that we know are commonly done around the home in Grenada. But in addition to this, all the interviewers were trained on an extended list of questions, activities, that are included in domestic care. This contextualized list is based on the 2016 International Classification of Activities for Time Use Statistics. So that was question number 1. Question number 2 asked also about yesterday. How much time did you spend looking after children who are members of your household or family without receiving any pay? Looking after children includes playing, bathing, helping with homework, reading, and taking to the doctor or to activities. Traveling or waiting time should be included in your answer. In this context, children is anyone under 18 years of age. And again, here too, the enumerators are trained. They were provided with a manual, and within that manual, we had a list of the activities based on the 2016 International Classification of Activities for Time Use Statistics, but we also contextualize it in terms of what those activities may look like in Grenada. And then for the third and final question, we asked yesterday, how much time did you spend caring for adults who are members of your household or family, including elderly, sick, or disabled without receiving pay? Caring for includes feeding, personal and physical care, talking with, helping with shopping and or paying bills, providing help with taking medication, and so on. Traveling or waiting time should be included in your answer. And again, all of this is based on the guidance provided for collecting data for collecting data for SDG 5.4.1, as well as the list of activities in the classification that I talked about earlier in the activities for collecting data on time use. And here it's important to know that adults in this case refers to anyone who is 18 years of age or older. It's not just the elderly or disabled we are talking about when we ask this question. So today I'm only going to present to you the key finding we found by sex. We also did look at, though I don't present it today, by age group. One of the shortcomings though of using the labor force survey to collect the SDG 5.4.1 is that in Grenada, the labor force survey, the sample used can only collect national statistics. So we were unable to do by any location breakdown in terms of looking at this information. So what we see here is that, and this is not unexpected, a disproportionate amount of time is spent on unpaid domestic and care work by women and girls. And if you look at the one on unpaid childcare, you see it's very stark. The difference here it's 5 times higher. The average time spent by women compared to that spent by men. One of the things I do have to mention though is for the labor force survey in Grenada, proxy responses are accepted. So here, although we know internationally proxy responses are not recommended for time use data, we did pilot to see whether or not, in agreement with the statistics office because of cost and other issues, to pilot using proxy responses. And what we did find at the end is that proxy responses were always underreported. Sometimes on average, the time spent reported by a proxy respondent is half that reported by someone who reported about their own activities. So how does this information contribute to human development? In addition to reporting to SDG 5.4.1, there are some policies that can be interventions that can be used to help redistribute the imbalance of care that we notice, not just in Grenada, but we notice that world over. And some of I have 4 listed here. These are just 4 of the examples. There are others, of course, that can be used to redistribute that imbalance. And for one example is paid parental leave. so that both men and women are provided with time off to take care of the infants or young children in their home. In places where this policy has been implemented, we do see also a cultural shift in the perceived role of the father in the home. Another example is policies around flexible work schedule. We know, especially among women who often have to make a trade-off between paid work and unpaid domestic and care work, flexible work schedules can help some to either continue their paid work or even to enter the labor market. And then the redistribution of unpaid care work can also be achieved by initiatives that target access to early childhood education programs, childcare facilities, as well as elder and disability care facilities. So these are just some of the examples that this data can be used to use further additional use for this data, except just reporting on the SDG 5.4.1. So this is the end of my presentation for today, and I welcome your questions and comments during the discussion session.
Thank you so much, Claudia. You actually touched on one of the questions I have later on. Maybe I like that you already pointed out the policy interventions that could come out from the use of this data. And it is something that I would really want us to discuss as we talk about the data that we produce and how we track human development. How is it that the data translates into actual policy interventions? But before we go into the questions, it's thought-provoking for the question and answer segment. We will listen to Jean as he takes us through the dashboard that was created for the OECS Commission. Good morning, Jean.
Good morning, Sharma, and thank you very much for having me with you today. It's a great pleasure, and also thank you for the very interesting presentations. And indeed, what I'll be speaking about briefly is really about a tool that we've built together with the OECS Commission and all the member states that we call the Scorecard, and that's really focusing on how to bring all of this data a step closer to decision making. I'll share my screen with you, and I hope you see me fine here.
Yes, we do, Jean.
You see the scorecard? Perfect. Yes. Okay, excellent. So what I'm showing you now is, as you can see, it's not a PowerPoint, it's an actual website, and this is still with our own address, but it will go live soon. It's a project we're undertaking with the Commission of the Organization of Eastern Caribbean States. And the objective of the scorecard is to bring the ambition to having a regional development strategy and really achieving some key ambitions of regional development strategy, and bringing that together with the type of data that we've just heard about and a whole lot of other types of data points, and try to help policymakers and really everybody to keep track of, well, what's the ambition we've set out, where do we really want to go in terms of our development, and what is it that we're achieving. So this is the beginning. The scorecard comes in 3 big blocks of the OECS development strategy, and the strategy has been formulated in 2018, 2019. We're pitching the scorecard to reach to 2030. And pulling together indicators around the 3 big blocks, which are economic development, growth, then environmental development, if you want, making the best use out of natural resources, and then much closer to the theme of this conference, human development and social development. So you see here are the economic indicators, then we have environmental indicators, and then we come to the social indicators that very much include human development. And I will just focus on this area now for this presentation to get you the idea. I'll just spend a tiny bit of time to explain it, and then very happy to take questions later. What we have done is really pull together those indicators for which we could find data points across the member states for sufficiently many years to really have a time series and to have data points of which we know that we will be able to collect them on a regular basis, ideally once a year between now and 2030, so that they can come in here and populate this database to compare vis-a-vis the target that member states are setting right now. And so you see here some of these key indicators. You see for how many countries we have this data. You see the performance of this indicator over the past 10 years. You see where this indicator was in 2020. And you see very importantly back here what the target is that the region and the member states have set for themselves. And here very importantly, this target setting is a process we're at the moment going through with all the member states of the region, where the member states are going through a survey to really confirm what their targets are for 2030 or for the types of annual growth that they would like to see. And then this will together be put back in here to show us the regional target that the region wants to see. Let me show you here, for example, for the first data point that we have, which is already an interesting one, which is the formal employment to population ratio. We've just heard from Grenada about their labor force survey. We've unfortunately found that when you look across the OECS region, there is very few labor force surveys that are done regularly. So what we did was to go out and speak to the national social security institutions to receive the number of people registered there as a good data point for what we call formal employment. So people that have a job and that are registered with National Social Security. And the target that we have here as a working target for right now would be that 74% of the working age population across the region should be in formal employment. The current target here is 54%. So over the next 10 years, ideally, this should increase by 20%. Now, let me show you what else the scorecard can do. When we click on the view more, you see here how this looks like across member states. So what you've just seen was the regional average. The regional average here is 54% at the moment, and we want it to be 74%. And then you see here the time series of this data, in this case over the last 20 years, and where ideally all the member states should arrive in 2030. And you see the type of ambition that would be necessary. You can, and what I find very interesting from this human development perspective, when you look at this data, you see it's fairly stable in most countries. So you see also that there are structural factors of some countries having fairly high shares of formal employment, some other countries having lower shares of formal employment, so clearly a more significant informal economy, and also higher unemployment challenges. And you can see that to reach this target, there is a lot of policy action that would be necessary. And you can see then here at this level, for each of the member states, where the achievement is at this moment and where we would like it to be in 2030 and how this will develop over time as we populate the data. What's very important really to re-emphasize, right now we're going through this process with member countries. So the 74% is a number we've put here to populate, but currently member countries are reviewing this and will confirm their targets with us. And these targets would then be the targets that we would put into the scorecard. So just to bring you quickly back to the other indicators that we have in here, and I think this can already be an interesting experience to see what the other targets are for which we found enough data and what the number of points are for which we've not found enough data. And maybe with that, then I'll leave you. So we have indicators on safety, intent. We have crime statistics and homicide statistics. We're looking at health expenditures, share of GDP. We're looking at the out-of-pocket expenditure on healthcare, trying to really support this ambition to have a broader scheme to go more towards universal healthcare. Maternal mortality ratios, neonatal mortality. We're suggesting this indicator on obesity as a lead indicator towards cardiovascular disease. And then we're looking at pre-primary enrollment and the share of trained teachers, both in primary and secondary education, where we find across the region that enrollment in education is fine, but this share of trained teachers is a challenge and is something that needs to be focused on. And maybe as we're here in this space on human data, we have a number of other indicators that we think would be really important to track this vision for the region, but for which data to come by is challenging. So there is labor force surveys, which are somewhat lacking, and therefore it's difficult for us to find good productivity data where we would divide an economic output by the number of people working in a sector or more broadly. Then employment figures are more broadly. That's where we had to take recourse to this formal employment figure that we constructed. Poverty figures are also challenging to have. And then again, on the health side, more information on cardiovascular disease would be quite important. With this, let me maybe come to an end. I know it's on human development, but I'll just show you quickly our renewable energy indicator, because I think this is the one that makes the best case for how this tool can really be useful. And then I will stop there. You see here, we have a renewable electricity output as a share of total electricity. In the global UN process towards fighting climate change, all countries have made national determined contributions. And so, of course, have the member states of the OECS region. And these have been quite ambitious. So we've taken these nationally determined contributions to climate change from the member countries and have plotted them here as the key targets, together with the historic data on this share of renewables in electricity production. And you can see that the historic trend in all countries is very stable and that the ambitions are very significant. And so this is really where I think the usefulness of the scorecard really comes to bear, because it says, okay, these are commitments that countries have made. This is where the track record is. And so then it is really key that important policy decisions will be made, and this can be used. And then the scorecard can be used to really see, is this really the way we are managing to go? Is this really where we can get to by 2030? Or if not, what are the types of policy decisions, of investment decisions we need to make right now to be able to go there? And this on an annual basis in a strategy review process is really the ultimate objective of this of the scorecard. With that, I will leave it here, and I'm very much looking forward to the discussion.
Thank you very much, Jan. It is every data user fantasy to see a dashboard like that, because we know one of the main problems with data in our region especially is dissemination. But to be able to go to this one stop and get all these indicators, it's a data user dream. So we cannot wait for this tool to be accessible. I'm sure every attendee is smiling and saying, I can't wait for this to be up so that we could access the data. Thank you so much for that. So now we open for questions and answers from our attendees to our panelists. And before, I see we have a question so far in the chat, but even before that, Jan, since you mentioned it, the labor force surveys, you talk about how few labor force surveys we actually have in the region, but it is something that the OECS Commission under the Statistical Service Unit is actually working on. We are piloting our revised OECS harmonized instrument and helping the countries to one, conduct these surveys and to help with the frequency of it. So we are working with the ILO as we speak, piloting this new instrument and getting our member states to conduct the LFS. So for sure, in the next 2 years, I can assure you that we will have more countries who would have the LFS data set and the LFS indicators. That of course will be plugged into this toolkit. Okay, so I see we have a question here from Joy. This is a general question. It says, how does measurement of Human Development Index help keep track of human development? How is it calculated? How does the measurement of the Human Development Index help keep track of the human development? And if anybody could tell us how this is calculated. For any one of our panelists. How do we track human development with these human development indicators? Perhaps we could go to our colleagues from the MIX. We have so many indicators that come out of the MIX survey. How do we use these indicators to track human development?
Sharma, this is Attila speaking.
Yes.
May I come in?
Definitely, thank you.
Human Development Index is not something that we specifically work on as the MIX or UNICEF. However, our colleagues in UNDP are responsible for that, as you know. the Human Development Index has three main components to it: health and education and standard of living. I can put a link to the Q&A for a website that our colleague can go and check the details of how to calculate the HDI.
Wonderful. Thank you very much, Attila. Anybody else wants to jump in response to that question? Don't forget, attendees, to please put your questions in the chat. Okay, so we know that we've been collecting a lot of data, and the mixed data set, and even Jan, a lot of the indicators that are coming from these surveys are going to feed directly into that dashboard. But for Claudia, and even to Attila and Tatjana, how have you seen? I see Claudia mentioned it. So Claudia, I will take you afterwards. But how have you, if ever, have you seen the indicators that come out of these data sets actually impact policy formation and even reformation? Have you seen that? For example, all these mixed indicators, has it actually informed and resulted in a change on implementation of policy in your experience? Yes, Attila?
Well, this is something very fresh in my mind because we have just finished producing a video for advocacy and promotional purposes on the impact of mix. And we have used in that 6-minute video, I believe the video is also on the virtual marketplace. And in that video, we chose one country and one topic as an example to show the impact of mix. And in the case of this video, and we have thousands of examples, of course, we chose one which would make more impact for the audiences. In that video, we are covering water quality testing that we are doing in mix. And the chosen country is Nepal. In that country specifically, where we conducted the mix in 2019, and found out that there were very high levels of drinking water contamination. The government took action very fast, and they were able to start a program together with UNICEF at the local level, based on the findings, based on the insights that was obtained from the mix itself, to start purifying water and taking care of the water sources and the provision of the services of water to the households. That's just one example. There are many other examples, including in the Caribbean region, where we have found in Belize, for instance, problems to do with child nutrition, the dietary intake of children, on which the Belizean government took some action. In Cuba, for instance, we used mix to validate the change in the vaccination policies, and they found that there were some shortcomings in their campaigns for the new vaccination procedures, etc. In Dominican Republic, I remember that the mix showed a less than favorable engagement of fathers with children on their development, on the child development in the home environment, and a campaign was started on that one. So there are many examples where a mix is conducted, and given the findings and the evidence produced by mix, the governments take action. In our case, I think, and thank you very much, Sharma, for your very kind words about the way that we work in the countries. In our case, because mix comes as part of the cooperation between UNICEF and government already. So it's not sort of an external tool which comes into the picture. It is already we always talk about the utilization of household surveys, right? The data, that the data remains on the shelves, the reports remain on the shelves and nothing is done. In our case, I think the story is a little bit different because the mix is conducted within this cooperation framework, and there's already places, policies or programs or plans that mix is intended to provide evidence to. So the utilization is probably more straightforward in our case than in many other household surveys.
Perfect, excellent. I think for every researcher and every statistician, the greatest satisfaction is seeing that the indicators that you produce actually change the quality of life for people. And in some cases, I even say it saves lives, because the interventions could actually be life-saving in terms of who do we target for healthcare, who do we target for early childhood education. These things have long-term impact and effect on the quality of life and human development for our people. So for me, that is the greatest satisfaction, is how this data actually, how it's used and what policies are implemented as a result of it. And hats off to Mix and the indicators and how the data is used. Now, I saw that Claudia started to mention the number of policy interventions that were recommended from the survey that was conducted using the LFS for SDG 5.4.1. So Claudia, tell me what do you think has happened and what do you think could happen as a result of the research that was done?
Okay, so in this case, we can speak about what could happen. This was a pilot, so this is not official statistics. It's a pilot. We were testing the use of those stylized retrospective questions in the LFS. We've recommended that it also be included in the harmonized LFS questionnaire that you spoke about. This is, although the pilot is done in Grenada, it is an OECS project. So it does have potential to have implications across the OECS. What we did is that in the report on this, which will soon be public, we do recommend further use of the data. So researchers we give ideas of some of the questions that researchers can further use that data to look at, as well as mention some of the policy issues that we think this can be done in the OECS or Grenada for once we have actually implemented the questions as a long-term strategy in the LFS and have good data on it. We can then use that to advocate for policies that can change that imbalance. That's for the OECS, but I've done work where it not in the Caribbean, but I've done work in the past where I've seen policies are actually being implemented. And yes, as a researcher, it feels really good when that happens. Even for one of the examples I gave in terms of a parental leave in Canada, where I also worked for a very long time. Now, parental leave is very common. Both father and mother take time off. They usually split the time. Usually it's a year, and you can split that time. The father takes half, the mother takes the other half to stay home with the newborn and so on. So yes, I've seen similar data used for policies, but it's not always the case. You have a lot of cases where it sits on the shelf and it just bugs you and you think, I've worked so hard on this. This is so important. Let's find a way to push it forward. But yes.
Unfortunately, exactly. Thank you for Claudia. But we have a few more questions for you. And Jan, we do have a question for you, but I'm just keeping it within the theme before we get to you, Jan. So there's some questions, Claudia, for you. Someone's asking, right, how does the information on unpaid care in Grenada differs between men and women as you compare it in other parts of the world?
Okay, so I must preface this by saying that this is not official statistics. This is a pilot we did testing the question. However, the trend that we saw is very similar to what's seen elsewhere in the world. It's where women and girls have a disproportionate amount of time on unpaid domestic and care work. It's very similar to what we've seen elsewhere.
Good. Secondly, what is the potential for integration of the questions on SDG 5.4.1 in the toolkit being developed by the OECS Commission?
Right, the potential is high. As I said, this is even though the pilot site was Grenada, it is an OECS project, and so we do liaise with the OECS in terms of they are aware. There has been discussions about including it in the harmonized, the newly revised harmonized version of the labor force survey. And it's
as a matter of,
if one of the
sorry,
things
Claudia.
I should mention, this is not something that you would do every quarter. Although we do recommend that in the beginning, it's done every quarter to see if there are seasonal patterns, to these seasonal changes. Even though there's not a stark seasonal differences, but we know, for example, in the OECS around Christmas time, if you put it in a labor force survey that occurs around Christmas time, you may see a high jump in the time spent on those activities, because we know across the OECS around Christmas time, there are a lot of unpaid domestic work going on in every household. So we recommend you do it in the beginning every quarter to sort of a measure and see if there are seasonal differences that you can adjust for, but then going forward maybe every 3 or 5 years, because we don't expect huge differences from year to year or quarter to quarter necessarily.
Thank you. And just to confirm, yes, Claudia, the module has been placed in the revised LFS questionnaire, and it's a modularized approach. So the countries could add and drop the modules based on the frequency that they think is best for their countries.
Yes.
That has been adopted, thankfully. A last question before I take questions from another thematic area under this, more specifically to the scorecard, as I see some questions are coming up here. So somebody's asking, they're saying, I am curious to hear about the challenges and feedback experience in conducting this survey. Was it well received, and was awareness achieved? That's
okay.
Claudia again.
Okay, so it's not a survey, it's 3 questions within the labor force survey. So the statistics office goes out quarterly to do labor force surveys, normally in Grenada. So in Q1 of 2021, we included those 3 questions that were asked, also about unpaid domestic and care work. In terms of the reception, the enumerators were well trained, and that's why in the beginning I said it's an essential part of including those questions in the labor force survey. They have to be well trained in order to respond to questions they may get as to why are we asking those questions? Why is it important? Why do you need to know this? Because it's normally they're asked about their paid work in the labor force survey. So the interviewers were trained. We had some people ask why, but when told why it was important to measure, that it's part of the commitment Grenada made at to measure SDG 5.4.1, and also why it's important to measure it in terms of for policy implications of it. People responded, so the response rate was quite high. As I mentioned, the only issue is that because the labor force survey accepts proxy responses, we did not always get the response from the person who directly did the unpaid care work. So in that case, we got it from another adult responsible member of the household. And we know that there is issues with that. So going forward, we recommend not using proxies. But we did not, it was, I think having well-trained interviewers, having them trained and pre-test and practice how to respond, and it helped a lot in alleviating any issues that may come up in the field. And we did have high response rate, yes.
Wonderful. And just to echo, a proxy is what it is, a proxy. And the best is to have the actual respondent. So
right.
Exactly. But that you actually got a high response rate, and the data was useful. Even in cases like this, it is testament of the quality of and the implementation of the survey itself. Before we take additional questions to our other panelists, I see questions here for Jeanne. Jeanne, people are asking, when is the dashboard going to go live? Like me, they want to know.
Sure. So we're hoping by June this year. So not too distant the future. Now, don't tie me to it, if it ends up being July or August or September, but that's certainly the plan, and that's the framework of our collaboration with the OECS.
Wonderful. So by June, attendees by June, we should be going live. Also, what is the plan for sustaining and updating data on the scorecard?
That's an excellent question.
Excellent.
As I explained, we're working with the OECS Commission and all the member states. And so we have a whole governance framework built behind the scorecard, which consists of having counterparts in all the member states that coordinate locally with all the relevant ministries and agencies. And those are also the ones that are currently going through this to confirm the national targets. And so the structure going forward is that, for one, the scorecard, as you see it, has a lot of, as you could see, has a lot of programming behind it. So a lot of the data, as soon as national statistical offices share this with the relevant international databases, this will get pulled automatically from there to populate the scorecard, to update the annual data. And then for the other data points, like the one on the national social security offices, we're in the process of creating that loop with this governance structure that's between the Commission of the OECS and the member states and their focal points to ensure that this data will always be updated. And then I'll use the opportunity, because there is, of course, this very important question on, how will this be populated, updated? And then the even more important question of how will this actually be used? And I'm very excited, Sherma, that you see the use in it and you find it exciting. And I hope that many people will look at it. But of course, also a very important part of this is that the governments of member states start using this, and that there'll be discussions around this at the OECS Commission on ideally with an annual rhythm, where you come to some rhythm of looking, okay, so what was the plan for this year? Where did we get to? What does this mean? And I think something that can be very interesting here is we already see it now from having pulled together this data, that you really see some countries showing a very interesting trajectory on an indicator. So you see they all go like this, and suddenly a country manages to start climbing. And that's really the point where it would be then interesting to have a discussion and start trying to find out, why is Grenada suddenly moving up on formal employment, and what is it that's been done? And I think that's also what I'm hoping to see going forward, that this can be a bit of a basis for asking each other questions and finding out, because I do assume often it's not even, people might not even know that they're doing well, and the answer might not be just one thing. It'll probably be a connection, a mix of a whole lot of things that are happening. And that would be quite interesting to find out more and to have a basis of for sharing this experience and learning from each other.
Thank you, Jan. Sonia is also asking, how often would you need to refresh the data in the toolkit to reflect accurately data on the region? Is it going to be annually? Biannually?
So far, we've built it all to show an annual progress. Mainly because most of these data, we're already, a lot of these data points, even from what we've seen, we only would get them every 2 or 3 years. But we have this ambition to have an annual update.
Okay, annually. Also, in the opening, the Director General of the OECS, he did speak about this new project that the OECS Commission has signed on with the World Bank. It's data for decision making. And coming out of that project, we have 3 countries who have signed on, actually: St. Lucia, St. Vincent, and Grenada. But in collaboration with CARICOM and the Caribbean Development Bank, we are planning to provide that same kind of assistance to our other member states. But coming out of this initiative within the 5 years, we are hoping to produce a lot of indicators coming from the census, the labor force survey, and any other household surveys that these member states are going to produce within that period. So for me, it's we have a lot of data and even historical data that already exists, but is not in one place that you could actually see a time series like you so well showed in the dashboard, and that we could start plugging in and be able to tell stories of what's happening in the region. So I'm excited. Let me see again in my chat. Okay, we have a question again from Joy. Is the track human development, okay, able to reach our career goals? Tracking human development is able to reach our correct goals. I'm not sure. Joy, perhaps you could be a little more specific, or if somebody gathers what this question is asking exactly. But it's tracking human development. Is it able to reach our current goals? Okay, while we let that sink in for a little bit, again to the mix, Tatjana and Attila, I wanted to ask, I see that we have moved to this hybrid approach of using the telephone surveys, and it is something since COVID that our countries have been forced to use to gather information or to collect data. What is your experience with actually collecting the data via the telephone? How is that working out? How's the response rate? How okay are people with it, especially mixed that is very detailed? How do you find gathering the data over the phone being?
Maybe I can come in and Tatjana can complement. Of course, we're not dropping Mix itself and face-to-face interviews at all. If anything, Mix Plus is based on Mix. It is dependent on Mix, because the main template that we have when it comes to Mix Plus is to conduct the Mix face-to-face first, and then extend the Mix sample into doing phone interviews through Mix Plus. However, on Mix Plus, of course, our experience is probably very specific to the methodology that we're using, in that we have very high response rates, above 90% for the first few waves, and then we have some attrition afterwards, which can go down to 85%, the response rate. So we're talking about very high response rates. There are obviously limitations and advantages to the phone interviews. They're low cost, obviously, and in cases like COVID, when there are lockdowns, of course, it's a very useful option. On the other hand, we have to know that not all kinds of data can be collected over the phone. There are certain things that we do in Mix, for instance, measurement of children's heights and weights.
Yeah.
Obviously, you cannot do those kinds of things. You cannot do observations. You cannot do biomarkers. You cannot do tests, etc. There's a number of also topics which are very sensitive topics and need to be done face-to-face after building that face-to-face rapport with the respondent. Things to do with violence, with sexual violence, things to do with sensitivities, with contraception, for instance. Those are also limitations of the phone surveys. And plus, because of the methodology that we're using, which is basically to interview an adult household member of the household, we only include those topics in Mix Plus where we know, and this is something that Claudia referred to, we know that the proxy respondent, one person from the household, will be able to provide reliable information on other household members. We confine ourselves to those kinds of topics, basically. But overall, our experience has been great. We are making a lot of progress as well to show in concrete terms the reliability, the validity of the methodology that we're using when it comes to especially sample implementation. And the first results from these two surveys that we have completed, 2 Mix Plus in Georgia and Mongolia, also indicate that for the topics that we have been covering, we are able to come up with estimates of indicators which are very close to what we would get from face-to-face surveys. So overall, I would say that our experiences has been extremely positive. And also, I would like to say that one of the criticisms to household surveys in general, and you mentioned it at the beginning as well, Sharma, that household surveys, or one of our colleagues, that household surveys do not come that often, right? You cannot stage household surveys every month, every 2 months, every year. But with Mix Plus, we have the flexibility to collect information, to collect data every month, every other month, and be able to report the results every month, every other month. So we are building almost a real-time reporting system based on a household survey methodology. Tatjana, would you like to add anything onto what I've said?
Yeah, I just want to, you said almost everything. I just want to mention an example from Mongolia, how valuable actually those data were for the country. during the COVID, there was a lot of changes in education. So based on the result of Mix Plus, because they were asking our respondents if they are satisfied with the distance learning options provided for children, and if not, why, they discovered there is a very low coverage in rural areas, for example, and the children cannot understand the lessons because the main mode was TV lessons. So they took immediate action and they improved. Of course, as I'm saying, they could not buy televisions for the children or IT equipment, but they were working with the local schools and sending teachers to those areas, remote areas, to help children to learn. So, and they were also changing the content of the lessons on the TV. So it improved a lot. So these are the things, again, what you and Attila mentioned. You need to wait a household survey face-to-face to find out some things. But with Mix Plus, based on households, you can do a lot. You could have representative data for the country. So I think these are the great things, really. And yeah, I'm very happy to as we all are saying, we are very happy when we see that our data are good quality and used for good purposes, especially to help children.
Excellent, exactly. Thank you so much. Thank you so much, panelists. I mean, we have come to the end of the time we have allotted for this morning's session. We have addressed, I think, all of the questions that came through the chat, luckily. And this has been quite an informative session and an exciting one for me. And, you know, as researchers, I continue to say we're actually in the business of saving lives. Okay, we're data doctors, not doctoring the data, but saving lives through the use of data, transforming data to information. And just before we leave, we have this poll that has been popped up. It is for us to give, for you to give a quick evaluation of this morning's session. It doesn't take time. We're encouraging all our attendees to complete this survey immediately, please, before we leave. Thank you so much again, panelists. Thank you for this morning. Jean, please continue to help bring this data out to the user from the field to the user. Great job. And Claudia, of course, measuring unpaid work. I mean, this has been a challenge for so long. And coming from the national accounts background, I can tell you this is something that has serious undercoverage in official statistics, and bringing it to this point is a wonderful thing. So thank you all for participating this morning. Thank you for being with us. And we just want to invite our attendees to our next session. Our next session that starts at 10:40, exactly 10:40. And there we're going to be discussing the power of data in social protection, including the case for universal childcare in Barbados. So we invite you to log on to that session at 10:40. And I think we're as the poll is being completed now. Yes, persons are completing the poll. So thank you again. Have a wonderful afternoon and keep doing what you're doing. You're changing lives. Thank you. Bye.
Thank you.
Thank you so much. Bye-bye.